Welcome back to our next episode of LCME and Me as we prepare for LCME accreditation. In this episode, we're talking about regional campuses. Specifically, what does comparability mean when it comes to regional campuses? What are the expected relationships between faculty at the different campuses? And so we have background. We have 4 campuses in the College of Medicine, and those campuses exist across various phases in the curriculum, various academic years. So our campuses in Lexington, Bowling Green, and Northern Kentucky have students across all 3 curricular phases, across all 4 academic years. The RPLP in Moorhead has students in the 3rd and 4th year. So when it comes to LCME, the different expectations for regional campuses are embedded in multiple different elements, but there's one element that in particular focuses on this, which is 8.7. And that element is titled comparability because that's at the heart of what the LCME emphasizes around regional campuses. And specifically, that element, as you can see here, says that the medical curriculum includes comparable educational experiences and equivalent methods of assessment across all locations or campuses or other sites, so that students achieve the same medical education program objectives. And so in the end, the students have to be able to accomplish the same outcomes in a very similar way, and we need to be making sure that the students are meeting those same standards regardless of which campus they're at. How our curriculum works is we have one course or clerkship that's delivered at multiple campuses simultaneously. So we have multiple campuses that are existing within the framework of one course or clerkship. And so what that means is there's one syllabus for that course that then is used by the students at all campuses. And that syllabus defines one set of learning objectives. There's one set of course requirements. There's one standard for grading. And so that is a singular course, but it's just being delivered at multiple campuses. Now, what can vary a little bit in the structure is the teaching and learning experiences can vary somewhat if needed to maintain comparability. But the standards the students are held to, how they're graded, the objectives they're trying to meet, all of that is exactly the same at all of our campuses. So comparability is important. So here's a question that you can assess yourself on. So who should be responsible for ensuring that a campus is comparable to other campuses? And you can choose whichever of these you think applies. Is it the teaching faculty at that campus? Is it the site director at that campus? Is it the course or clerkship director? Is it the curriculum committee? Is it some combination of these? What do you think? Well, definitely the site director at that campus should be looking at comparability and saying, how does the course that's being delivered at this campus compare to other campuses? Definitely the course or clerkship director who's overseeing that course or clerkship at all the campuses. Certainly the curriculum committee who has ultimate responsibility for the curriculum, including how that course is delivered at all campuses. It's probably not realistic for the individual teaching faculty who are delivering sessions or overseeing students clinically to be responsible for comparability. So how do we assess comparability? Well, we use a variety of different data. So things like you see here, we use student performance. How are the students performing in the course at the different campuses? How do they evaluate the course? How do they evaluate the different teachers? What are the teaching and learning experiences that are actually happening at those campuses? We use survey data to measure the students' perceptions of their experiences on each campus. So there's a lot of different data that we're triangulating to see about how comparability is working. And who's looking at that? Well, different people in different roles. So one person or one group of people that's looking at that are the course leadership, and that includes the course or clerkship director, and that also includes the site directors. And they're looking at this different data to say, how are the students performing at each of the campuses? How are they evaluating it? How are the experiences happening? And so they're looking at all this data to make sure that things are comparable. Also, the curriculum committee is looking at this data, particularly at the course level in our QA or quality assurance process. As they review each course or clerkship, they're looking at how have the students performed in this course? How are the students evaluating it? And they're looking at how are there important differences between campuses in these metrics. Also, the curriculum committee is looking at even more globally in their phase review. So as they do a phase review of the core principles phase or the application phase or the advanced development phase, they're looking at this type of data to say across the phase, across the courses and clerkships in this phase, are there important differences that are coming out between campuses? Or are the experiences of the students in these courses and across this phase comparable? And so in our DCI, we will provide information to the LCME about comparability, these exact things that we've been talking about. So summarize the data and information sources that are used. Those are those data that we were just talking about. Describe the individuals and groups responsible for reviewing and acting on data related to comparability. And so that's those same people we were just talking about. And I can envision an LCME site visitor asking a question such as, in your course, as a course director, how do you ensure that there's comparability across different campuses? And so think about how you might answer that question using some of the data that we were just talking about. So some other issues that are important as we consider coordination of courses across different campuses. So one is leadership, and it's really important that we have clear leadership of each course. And we provide the LCME with an organizational chart illustrating the relationship between site directors and course and clerkship directors. Also, we have to have really effective communication across campuses. So we also have to tell the LCME how and how often course and clerkship leadership communicate with site leadership and faculty. So for an organizational chart, our course or clerkship director who is overseeing that course or clerkship is responsible for that course or clerkship at all the campuses. So they're responsible for all of the students' experiences in that course, regardless of campus. Then we have site directors that are over the experience for students and over that course at their specific site. So we have a site director for Bowling Green, for Northern Kentucky, and for RPLP. Those site directors report up to the course or clerkship director, who's ultimately responsible for the entire course at all campuses, including the Lexington campus. And it's important that those people are communicating regularly and in a meaningful way so that they can plan for the course, so they can have shared expectations for how things are going to work through any issues that come up, and deal with any comparability challenges that might arise as they're planning for and delivering the course. But beyond this, the course leadership, the course directors and site directors, it's also important that we consider all of the teaching faculty that are involved in the course. So faculty that are delivering individual sessions or helping with small groups or providing clinical supervision. And the LCME asks us to describe how faculty members in each discipline are functionally integrated across regional campuses. And they give examples such as joint faculty meetings or retreats that might occur to involve faculty from different campuses, or visits by departmental leadership to a campus. And then how are faculty at these different sites or campuses informed about the learning objectives of the course, how students are assessed, the required encounters. And so I can envision another question an LCME site visitor might ask is, how do you ensure that the faculty at the other campuses are integrated into the course? How do you make sure that they feel a part of the course, that they feel part of the faculty, and that they know all the things that they need to know about what's happening in the course as a teaching faculty member? So in summary, we have a unified course or clerkship that's then delivered across multiple campuses simultaneously. The course or clerkship director is responsible for that course or clerkship at all the campuses. We use multiple forms of data to monitor for comparability, and we triangulate that data to give us different information about how comparability is doing. And it's important that we have really effective communication between course and clerkship directors and site directors so that we're talking across campuses and coordinating together to be able to deliver a course across multiple campuses. And we also need to ensure that all the faculty that are involved in that course know the objectives, the assessments, and they feel integrated into the faculty body. So thanks for joining us in this episode of LCME. We'll see you at future episodes.